Our mental health mini webinar today. I'll just start with a couple of quick housekeeping items. The webinar is being recorded and we'll post it for later reference. Please remember to mute yourself. There will be a chance for a question and answer at the end if you have anything and you are watching this live. You can also feel free to chat in your questions during the webinar and we can address them at the end. Today's discussion will be focused on supporting the mental well-being of school-age children, their parents, and teachers during this time of COVID. We'll hear from St. Peter's Health Clinical Psychologist Dr. Kaile Ross and East Valley Middle School Counselor Kevin VanNice. I'll turn it over to Dr. Ross to start.
Hi, Haley. Thank you for that great introduction. I'm so happy to be here today, getting to meet with you all to talk about the really important issue of mental health for our school-age kids. So I'm going to see if I can share my screen real quick. All right, there we go. So as Haley mentioned, today I'll be talking about mental health for school-age kids and their parents, and overall just what we know about how COVID has impacted mental health. So I like this first little comic, kind of talks about more of the upside of how COVID has impacted families and kids. So it says, there's never been a better time to stay home and practice a little social closening. So I'm sure from families and friends and maybe yourself have experienced that this time has had some pleasant upsides. So spending more time getting close with the people in your own home and your immediate circle. But then part of what I'll be talking about today is the not as great side. So this little comic says, I mean, a little in-house distancing wouldn't be the worst thing. And so this is part of what we're talking about with the COVID-19 pandemic and things that can shift mental health for the school-age population. So for some families doing remote schooling during the start of COVID pandemic, things like economic distress from changes in parent employment, and even just stress have added for families that already had maybe a stressful home life situation, that suddenly being together all the time can put increased stress on those families. So this chart talks a little bit about mental health in children before the pandemic hit. So this is data from 2016 to 2018, and it looks at depression, anxiety, and behavior disorders by age. So for this, it goes left to right, kind of youngest to oldest group. And so for the depression category there in blue, you can see 3 to 5 year olds, depression is pretty rare. Starts to increase just a little bit to even less than 2% of the population experiencing depression in the 6 to 11-year-old range. And then again, increasing up to almost 6% for the 12 to 17-year-olds. And anxiety follows a similar pattern, with anxiety experiencing a fairly large jump when you hit the 12 to 17-year-olds. And then a similar increase with behavior disorders by age for the 3 to 5-year-olds to 6 to 11-year-olds, and then taking a slight step back for the 12 to 17-year-olds. So again, this information is from 2016 to 2018, but what I'll start to talk about is across the board what the research is showing, and right now it's primarily focused on adults is what we know about COVID and mental health for the most part, is that there has been an impact specifically on kids who already had depression and anxiety, and COVID exacerbating some of those symptoms. So I also like to put up this survey specifically because a lot of times mental health studies underrepresent the prevalence for mental health disorders, because a lot of it's parent report, and so some teens might not necessarily be as open with parents during that age range. And so this is a study looking at the teens' perspective and asking about how much of the following is problematic in their own peer community. And so you can see the issues that top the concern list there are anxiety and depression, bullying, drug addiction, and drinking alcohol. So for teens, they see the biggest issues being mental health issues and substance use issues in their community. And again, this is 2018 data, so before COVID. So this one study is what we have so far in the literature looking at mental health and the impact on kids from COVID. I suspect with time, a lot more studies will be coming out looking at kid mental health during this time period. But sometimes publication can be a long process and take months and even years to get things ready for publication. So for now, this is kind of the early study of what we've seen in kids. So this one looked at over 1,000 parents. They did online surveys of US households, and they asked parents specifically to compare their mental health and their kids' mental health to the beginning of March. So before COVID was really on a lot of folks' radar, to compare their mental health at the beginning of June when the survey was done. So from June to the beginning of March, how your mental health has changed for yourself and for your kids. So 27% of parents report that their mental health declined. And then about 14% reported that their children's mental health has also declined. And in this study, they found specifically for female parents and unmarried parents, they reported higher rates of decline. And then families with young children also had the highest rates of declining mental health and behavioral health for their kids. And so particularly in this age group, we know that this is a group that you'd expect to see, especially among the parents, some decline in mental health because of sudden changes in how they're working, whether it's being laid off from jobs, whether it's suddenly having a job that's going remote, loss of childcare, and suddenly for a lot of folks having to switch to online schooling for their kids. And so starting to see some of that shift. And then specifically for kids that we'd like to talk about who are having some conduct disorder issues, and other conditions like ADHD, anxiety, depression. For kids, we know routine can be really important. So suddenly having this shift that occurred towards the end of March, April, and May, that can really put kids' mental health into a different perspective. On the flip side, I would also like to point out the silver lining of this data is that with 27% of the parents reporting a decline and 14% for their kids, the take home for this is the majority of people actually did not report a decline. So the majority of folks didn't experience a shift in their mental health or their kids' mental health, but also noting that there was a good chunk of folks who did experience that change. This data specifically is looking more at the adult side. So this is looking at the pandemic causing a spike in anxiety and depression on the adult side. And I wanted to pull this one up because we don't have a lot of good data specifically looking at kids in comparison to pre-COVID times. So what you can see from here is the orange is data from before COVID, so in 2019. And then the red columns are data on depression and anxiety after COVID. So this is data from in the middle of May. So COVID has been around for a couple months at that time point. And even on the adult side, what you can see is, so on the far left, you've got symptoms of anxiety disorder. So you had about 8% of adults experiencing those in 2019. And then once you shift over to May, suddenly you have 28% experiencing symptoms of anxiety. And you can see a similar pattern for depression symptoms and then symptoms of anxiety and depression combined. So I do want to switch over to what do we do about this? Since we know kids are very, very resilient. So a lot of kids have gotten to be very flexible at navigating online schooling or remote and are great at wearing their masks and kind of finding new ways of connecting socially. And so what we can see is that kids have been resilient for the most part. The kids that I would like to draw attention to and might need a little extra support during this time are kids who already have kind of underlying conditions. So those kids who are already dealing with depression or anxiety, symptoms of trauma, those sorts of things, are the kids that I'd say probably need a little extra support and wraparound service at this time. That being said, we could all use a mental health boost. So here are some recommendations from that angle of kind of what are some things that we could all benefit from. So this one here, I want to start by just talking about unplugging from the news or seeking out upbeat news sources. So in my digging, I found this website that specifically just focuses on good news. So it's called justgivemethepositivenews.com, which I think is fantastic. And I did a little digging myself to come up with some upbeat news, specifically focused on COVID news. So here's a great headline from a couple days ago. And I think this one's from the Washington Post. It said, feared coronavirus outbreaks in schools yet to arrive, the early data shows. So that's something that is a very upbeat news story. And then another one looking at a Texas aquarium introduced a sloth to a pair of dolphins, and the reaction is adorable. And part of the study, or that article, focused on the fact that they were able to do this because of COVID and they didn't have as many visitors at the aquarium. So they were able to introduce a sloth to the dolphins. And in case any of you are wondering what an adorable reaction from a dolphin looks like, here's a picture to let you visualize what that looks like. Yeah, look at that little dolphin face. The next thing I want to talk about is what I'm calling let them feel their feels. So it's okay for kids to feel sad, feel anxious, feel disappointed, and for the adults in their life to be able to validate that without necessarily feeling that parent or teacher urge to try to fix that for them. So just validating that it's okay to feel whatever it is they're feeling, because these are unique times. And I like that little quote on the side of, oh, the places you won't go. And just recognizing that there is a lot of disappointment for kids in the school age right now of things that they maybe were looking forward to last year might not be happening, or might be happening in a very different way. So letting them know that it's okay to do that. And a great story I heard one time of a parent-child interaction. There was a mom who, for her son, when he'd come home from school, and he was experiencing a little bit of bullying, that he didn't always want to talk about it, but the mom could always tell when he was feeling a little down. And what she would do for him is she would make nachos, and they would joke that it was nacho day. And so that was her way of kind of comforting him without feeling like she had those emotions, but still providing support and validating that it's okay to feel down at times. The last piece I want to talk about is shifting focus. So if you do have kids, or if yourself find yourself focusing more and more on worries about COVID, finding ways to kind of shift your focus. So one question, depending on the age of the kid, it might be appropriate to do is to kind of break things into controllable versus uncontrollable stress. So controllable things might be that you might be able to control your attitude about things. You might be able to control whether you're wearing a mask. You might be able to control, planning, making plans for the future, those sorts of things. Uncontrollable parts for kids are, vaccine development. That's out of your control. Whether or not other people wear a mask, that's out of your control. And helping them shift their focus to things that are within their control. Another exercise in this is sort of letting them recognize when they're getting really anxious or really worried, sort of what we call clicking the X box. So like in an internet browser, noticing when you're getting really worried and really caught up in those thoughts, and just kind of clicking the X to close out of them and change your focus onto something else. The last piece being the use of distraction. It's something that can't be understated. And so I'm going to put this picture up. So for any of you adults who are listening, that this picture looks familiar to, Joe Exotic and the Tiger King might know the power of distraction during COVID. So this kind of silly, sort of dramatic Netflix show was a distraction for a lot of adults during the time of COVID. And so similarly, kids can be really great at finding those distractions for themselves. So listening to music, even kind of having a snack, even things like that just kind of shift the focus and help them get out of their own. So this last piece I do want to leave folks with is, if you have a kid in crisis, and sometimes I even encourage other kids sometimes it's not them in crisis, but they have a friend in crisis and they don't know what to do for help. They can always text the crisis hotline and get support 24/7. Other ways of getting mental health is calling your insurance company. If you have a kid that you're worried about, your health insurance can often help you get connected with behavioral health persons that are covered by your insurance. Employee assistance programs, a lot of times adults don't realize that their kids are also covered through their employee assistance program and can get some therapy and counseling for free through that path. Nowadays, there's great options for telehealth and teletherapy. And then also your pediatrician can always be a great resource for asking for ways to get connected. And then I'm also just putting a link up there for NAMI. It has a lot of great resources for helping for parents, teachers, and also kids for coping with COVID stress. SAMHSA is a great resource for any questions about mental health or substance use. And then also the National Suicide Hotline as well for anyone's in distress who needs a little extra support. So I'm going to leave it at that for now, that there's lots of great ways to get connected. And whether you call a hotline or text, there are counselors who are always happy to help and happy to support however they can. And now I'm going to close out of this so I can turn it over to Kevin.
Hi guys, my name's Kevin VanNice. I'm the school counselor at East Valley Middle School in East Helena, 6th through 8th grade. So first, I'd just like to say it's great to be here today to collaborate with Dr. Ross and St. Pete's. And hopefully I can give some insight in terms of what we're seeing at the school level. Kids are pretty resilient. And that's the one thing I've taken from this so far. They really do adapt, and Dr. Ross and I were talking about this earlier. They're way ahead of us in terms of technology and their skills. So usually they know more about stuff than we do before we hear of it. So I have some scripted questions I'm going to ask Dr. Ross, and then I have some questions from students at the school. And then I think we have a chance at the end for any of you to ask questions as well. So Dr. Ross, the first question is, how do we help our children to be emotionally resilient during COVID? And if you want to speak to your end of it, I can kind of talk about the school stuff.
Sure. I would say, especially as a parent myself of 2 kids, whether as a parent or as a teacher, never underestimating the importance of kind of the role modeling you're doing, and making sure that we're doing the things to take care of ourselves and to even be transparent about some of our anxieties and our stress, but then also kind of demonstrating what we do to take care of ourselves and how we help ourselves be resilient. So a lot of times the things that we do when we're stressed, sometimes we, don't eat well. We might stop exercising. We might stop calling family and friends. And a lot of times those are the things that actually help us keep resilient and help us keep perspective on things. So making sure that we're doing that for ourselves and also helping our kids do that, of making sure that they continue to kind of eat well, get activity, stay socially connected in ways that are safe and healthy, and really being able to help our kids do that and being able to model that. And also to, again, kind of touching back on some of the other issues we brought up already of helping them unplug, helping them maybe even seek out upbeat news. And those sorts of things can really help our kids stay grounded and resilient. And of course, if you do have concerns that your child's mental health is deteriorating or could just use a little extra support, getting connected with mental health is always a good option as well.
Yeah, and I would agree and also say that we talked about adults having a higher percentage reporting depression. And that directly affects those kids. So we obviously see that even though they may not report it, they're being affected by it. And this whole thing for school has just really changed the way people look at school. And, it's tough having kids come in and say, hey, you're back in school, but here's the structure that you're going to be under. It's tough for them. They want to see their friends. They want to hang out with their buddies. So it's tough for everyone. Next question is, how do we help them handle disappointment about canceled events and activities?
That is a great question that I continue to think about. And I think back to, I like to talk about the difference between like acute stress, something that's short term, and chronic stress, something that's long term. And COVID initially started out as something short term that we were hoping to kind of get through and get out of the way and, it to be done by summertime. And that would have been an acute stress, but it's sticking around, which means it's chronic. It's here for a while at least. But I like us to think back to the beginning of COVID that we saw a lot of creativity around managing those disappointments. So things like the disappointment of, in some states not having an actual graduation for seniors. And so things like that people actually start to get very creative. And so sometimes from times of hardship, times of stress, a lot of creativity can come out of this. And so sometimes even dealing with the disappointment, I'd say acknowledging it, naming it for kids, letting them be disappointed, but then also helping them shift their focus and help them to engage that creativity. They might not be able to do an event the way that they previously thought, but even tapping into their creativity of kind of coming up with new ways to still be able to do parts of a specific activity or finding new ways of connecting and engaging. And I think if we step back, kids, give them that space to be creative, I think we'll be amazed.
I do too, and I agree. They're in a situation where everything they've known is different, just like all of us adults and teachers, and they're trying to fill that void with something productive and something they enjoy. So fortunately, we've got some activities going, some sports and some clubs going, and that's been a great boost for a lot of those kids at the middle school level. Next one is what signs to look for that a child might be struggling and where to seek help. You kind of touched on that earlier, but maybe some more follow-up on it.
I'd say especially the signs can be a little bit different depending on the age that you're focusing on. So for younger kids that can't necessarily articulate emotional changes, really we start to look at behavior changes. So on the younger kid side of looking at, frequency of tantrums, frequency of sort of behavioral outbursts, those sorts of things. And if those are increasing or becoming more and more frequent, those can be signs that that their mental health has shifted a bit. I'd say for older kids, especially in the middle, they can start to be able to identify changes. So even things like, seeing more tearfulness, more frustration, more being closed off, withdrawn. And then for teens in particular, social isolation, withdrawal, changes in appetite, changes in sleeping, which we're not always in tune to with our teens, but starting to notice some of those changes that might be happening. And for teens in particular, it's usually a sign in changes in their interaction pattern with their peers in particular can be a big red flag of not hanging out with some of the kids that they used to before, or just being very disengaged and withdrawn. And then also disengaged and withdrawn from parents, teachers, those sorts of things. So really looking at any sort of shift in behavior changes. And as a parent, you or teacher, you're always welcome to directly ask. And another thing I do always encourage is if you are worried about someone's health or well-being, it's always okay to directly ask, are you feeling depressed? Are you feeling anxious? Are you having thoughts of suicide? Because that's always one big concern, is that if you ask about suicide, it'll somehow plant the seed in someone's mind. We know from research that that absolutely is not true. That it's always a good thing if you have any concerns to directly ask about suicide and getting people connected with help immediately if that is present for them.
Thank you. And I've noticed the same thing at the school. They really need to connect with someone and trust someone. If they don't trust you, it's going to be real hard for them to say, hey, I'm feeling suicidal or I'm feeling depressed. But that communication piece is so important. I think we do a pretty good job connecting with our kids. One thing that we talked about at our school in a couple meetings is some of these kids absolutely thrived with distance learning and are struggling since we've come back. So it kind of shows you the gamut of learning styles. It's great for some people and some people really struggle with it. So that give and take. We did have a couple questions from students and for Dr. Ross. So their main concern was, when's the vaccine coming out? And that's an answer nobody really knows, I'm sure.
But it shows you that they're looking into the future. Yeah. They're yearning for things to get back to, back to better, and kind of focusing on moving forward rather than kind of focusing on that loss, sure. which is a good thing.
Yeah. And then the question they asked was about social media, whether social media plays into or fuels the fire of rumors about COVID and hearing false truths possibly.
I absolutely think that's a big concern. And I think, because scary news or headlines that provoke anxiety or fear, those sorts of things, are a little more sensational. So being able to consume the news or social media with a grain of salt. And even for teachers and parents, kind of teaching kids, how do you seek out information that's based in evidence or based in science? How do we find the things that we know have some evidence and support behind? So, and social media, it's kind of, a free for all in terms of what information gets out there. And so absolutely, I think that definitely feeds into increased anxiety and fear. And so I think definitely once you get sucked into that, I think my recommendation, sometimes you just need to unplug for a while from consuming too much news and media as well.
block, 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 right?
Block. Take a break and
That's
step
right.
back.
Okay, so I think, and Haley, you can correct me if I'm wrong, but are we doing questions from others?
Yeah, if anybody has any questions, I don't see any that were chatted in, which is just fine. If anybody, has anything that they just thought of, feel free to unmute and ask it. And if otherwise, if we have any other little pieces that you have on your mind, I do see perhaps there's one coming up here in just a moment. And you can certainly, like I said, feel free to unmute or type it in, whichever you're most comfortable with. Yeah, so this question says, I'm working on some things that St. Peter's Health can do for our employees that are parents for support. Any ideas?
Well, that is a great question. Because I think just from talking to family and friends, there's a lot of parents, definitely mixed, but a lot of parents feeling sort of relief and a little more hope with the school year starting back up, of that little sort of sliver of kind of returning to normalcy, even if things are looking a little bit different. So there is, I think, a feeling of a little bit more hopefulness. But I would say that maybe some of the parents that need a little bit more support are parents who have kids with some pre-existing medical conditions, because I think some of those kids are feeling a bit left out. The ones that parents have concerns because of mental or medical health not feeling safe to return to school. I think that isolation that's for the kids' own safety, that can kind of continue in this feeling of anxiety and fear. And so finding ways to, I guess, kind of help parents connect, and maybe even parent support group around parents who aren't necessarily being able to kind of see more of that hopefulness of the kids returning to school, because that's just not their family experience yet.
And I would agree and say that obviously we have to have a huge focus on physical health right now, but the mental health piece might get pushed back a little bit while we focus on the physical stuff. So just important for us in schools to keep that out there and let kids know we're still supporting them.
Yeah, that's great. Thank you. There might be one more coming in, so I think that was the end of the questions. Just to thank you for that answer. So if there isn't anything else that either of you have to add, we can certainly end there. And I want to thank both of you, Kevin and Dr. Ross, for your time and sharing this really great information.
Thanks for having us.
Thanks so much for organizing, Haley. It's great to be here.